Hi, I'm Dr. Dhanashri Wankhede, consultant ophthalmologist. I'm specialized in cataract and glaucoma. I'm working right now at Dr. Agrawal's Eye Hospital, Pimpri-Chinchwad. So let's come to the topic, cataract. It's very interesting and a vast topic, especially in senile people and old age people. What is cataract? Basically, we all human being has a crystalline lens behind this iris. This is our cross section of our eye. Behind this iris, there is a crystalline lens which is transparent. But if it gets opacified, it becomes a cataractous lens. Naturally, what happens when light goes through this natural crystalline lens, which is transparent, it falls on the retina, and we can see the image clearly. But if it get cataractous, means opacified, then there will be less light goes towards the retina and we will get blur vision. So cataract is just the opacification of this natural crystalline lens. What are the causes? Most common cause is age. It is called as senile cataract. Other less common causes include infection of the eye, previous infection, or inflammation, or some kind of trauma. And less common cause includes long-term use of steroid, either topical or systemic steroid. So what are the treatment modalities for the cataract? Only treatment for the cataract is the surgery. Uh, Before surgery, we need to undergo some investigation, which includes lens power calculation. What we do in the cataract surgery, we remove cataractous lens material and we left empty bag. Inside that bag, we implant artificial lens. So, uh, before surgery, we need to check the power of this artificial lens which we are going to implant into the bag. So, that power we measure from the anterior corneal surface and from axial length, which we measure by biometer. There are many types of biometer. Especially we use nowadays optical biometer, which are IOL master or lens star. And sometimes we use A scan and keratometry readings manually. Other investigation which we need is the OCT of the macula, which is not compulsory, but one should check for the macula. Macula is the part which is very small point which is required for a good vision, which should mean normal before the surgery. The scan of this macula gives us idea before surgery whether this point is normal or not, and if it is normal, then we can surely say that yes, after cataract surgery you will have good 6/6 vision. Other some investigations required before surgery are some blood investigation, which includes normal blood count, urine routine, RBS means routine blood sugar test, HBS, AG, and HIV. These are the common tests which should do before surgery, and one should get physician fitness for the surgery and ECG done. These are some important points we should do before surgery. Then, how is the procedure? What is the procedure of the cataract surgery? Previously, they used to do, previous cataract surgeons used to take incision, which are large incision near about 9 mm over the limbus, which is limbus is the part between sclera and anterior surface of cornea. And through that incision, they used to take cataractous lens in toto outside, and they used to implant artificial lens, which are rigid lenses inside the bag. this the disadvantage of this type of surgery was there required a lot of sutures, near about minimum 4 to 5 sutures required, and which may cause irritation, longer recovery time, and post-operative higher astigmatism power. So then there is there gets evaluation in this type of surgery. We call it as a SICS, means small incision cataract surgery. In this type of cataract surgery, surgeon made a little smaller incision than ECC. That incision size is near about 6 to 7 millimeter, and they make the tunnel inside the sclera and the cornea, and then they remove the lens in toto, left the bag behind, and then implant a IOL, means intraocular lens, rigid intraocular lens inside the bag. Advantage of this surgery over the ECC are there, as this is the valvular incision, so there is no need of suture. Most of the cases, no need of suture. It closes automatically as it is a valvular incision. And as incision size is smaller, there are less astigmatism and less astigmatic power after the surgery. Spectacle power. Now, sometimes we do SICS in complicated cases, like in traumatic cases where there is a weak bag. We need to put rigid IOL, that is compulsory in some cases. If there is a after trauma, the bag which where we put lens becomes weak, and in that case we need to put some rings and we need to fix the bag and then implant the IOL. In such a complicated cases, we usually do SICS or small incision cataract surgery. Now, since few years, we developed a cataract surgery as a refractive surgery. That is only possible because of the evaluation in the cataract surgery as a refractive surgery due to phacoemulsification procedure. Phacoemulsification is the procedure where uh, we took a very small minimum incision through the cornea, and that incision size is very small, near about 2.2 to 3.2 mm, and through that small incision, phaco probes goes inside the eye. We try to emulsify the cataractous lens inside the bag only, and aspirate all the lens material, and we inject a foldable lens inside the bag, which get opens inside the bag. The bag remains, the lens goes inside and it opens up there. This procedure is called as a phacoemulsification. We use phaco energy for that emulsification. So this is in brief the procedure of the cataract surgery. So now let's come to the advantages of this phacoemulsification. As I said, there is evaluation of cataract surgery from just as a cataract surgery, from cataract surgery to cataract surgery as a refractive surgery. Why I say that? Because in phacoemulsification we do very minimum incision, which heals even without suture, and the post cataract surgery spectacle power, astigmatism reduces significantly, and we can nullify the remaining or previously present astigmatism through some special type of lenses. We call it as a toric lenses. I'll explain it later. The advantage of this phaco surgery are faster healing time. The procedure of the cataract surgery become daycare procedure. No need to stay into hospital. Minimum astigmatism residual power, and minimum dependency on the spectacle, especially for the distant region. As I said, after removal of cataract, we implant intraocular lenses. This is a great evaluation in a cataract surgery. intraocular lenses are needed after cataract surgery uh, so that we can see clearly through without spectacles, especially for distant. There are how to choose then implant, uh, um, intraocular implant. So there are many material available. So the foldable material we should implant through the small incision. Foldable material is the acrylic material. And, acrylic material are of two types mainly. Some are hydrophilic material and some are hydrophobic material. As name suggests, hydrophilic material has an affinity to water. Uh, so the disadvantage of this material is there are the more chances of uh, uh, post cataract opacification behind the lens. So to avoid it, we developed hydrophobic material. Hydrophobic material is more superior than the hydrophilic material. These are grossly the types of IOL. Let me check about the question and answers. I got a question how to select about. I want to learn about how to select the right lens. Yes, I am coming to that point. And what are the safest medicines given for cycloplegia in cataract? Yes, I'll go for these questions later on. First, I'll explain how to choose right lens. One should choose right lens according to the need of the patient. For example, there are 2 to 3 types of lenses: monofocal, multifocal, trifocal, and some other toric lenses. Monofocal lenses. In monofocal lenses, distant vision get clear, but for near vision, patient has to wear glasses compulsory for reading. These are the monofocal lenses. One can choose any monofocal lenses if they are okay with the reading glasses. Monofocal lenses are many, some are Indian, some are imported. Any monofocal you can choose, but as I said, hydrophobic material is a superior than hydrophilic for long term. Second is other. If if a patient don't want glasses for distant and near also, then there are choice of multifocal or trifocal lenses. In multifocal lenses, they we can adjust for distant, intermediate, and near. But only disadvantage of this multifocal lenses, there are rings inside the lenses. I can show you. Like in these models, if you can see the reflection of this, there are some rings inside the this IOL. This is the model of the intraocular lens. It is it is the model. Actual size of the intraocular lens is the 9 to 10 mm. It is less than our fingertip. So these rings sometimes can obstruct during driving. Some patient can feel ring around their eyes when focus comes, especially at the night driving. So one should avoid uh, multifocal or bifocal lens if they are night drivers. So there is another type of lens, we call it as a trifocal lens. Trifocal lens is more superior than the multifocal lens as there are minimum rings, so night driving problem will be not there. Now I'll tell you about any multifocal, trifocal. These are lenses are also available with different companies, Indian or imported. Anyone patient can choose anyone, either Indian or imported. And then it comes to the fourth type of lens is the toric lenses. Toric lenses sometimes needed in a patient where there is a cylinder power of more than 1.5. Because as I said, the eyeball is the sphere, and we whatever we implant inside the eye is the intraocular lens. It is also a spherical lens. So sometimes patient has a different corneal power, and there are two types of power: spherical power and cylindrical power. Cylindrical power means power only in the one axis. So after cataract surgery, we can nullify spherical power, but the anterior corneal or posterior corneal cylindrical power remains as it is. Avoid it, there is a development of a special type of lens. We call it as a toric power. Uh, Surgeon implant that lens inside the eye and rotate it along the axis of the required axis of the required lens. These are the grossly the types of IOL. One can choose IOL depending on their need. If they want spectacle-free life, then they can choose for the bifocal or multifocal and trifocal lenses. But if they are okay with the reading glasses, they can go with any type of monofocal lenses. So, and regarding company, one can choose any type of company from Indian to imported, but it is always better to put hydrophobic material. And there are some small additions into each lenses, like clarity, night vision clarity, contrast sensitivity, uh, blue filter. These are added in some lenses, so one can go ahead with that lenses. So let me start with the question answers. Uh, One question is there: post cataract and ARMD patient has wave or curvy sight. How long will it take for wavy sight to disappear? Okay. Uh, See, as I said, even we remove cataract and implant the lens, the vision will be clear if there is a good macula. Macula is the point which is very important for the sight, which is located on the retina. And if this macula is abnormal, like in ARMD, ARMD means age-related macular degeneration. If there is a age-related macular degeneration, then there will be the blurring of vision or curvy sight, as it is called. Uh, so, as generally, age-related macular degeneration doesn't disappear completely. Some wet ARMD requires treatment like intravitreal injections and all. Uh, um, but some ARMD, like dry ARMD, it doesn't disappear completely. So patient may have wavy vision for long term or sometimes lifetime. Okay. We cannot remove that thing, that retina or macula part, or we cannot alter it. We can try with the intravitreal injection to reduce its swelling or membrane, whatever will be there. But we cannot promise that it will disappear after some time because it is age-related degeneration. Second question is, I want to learn about how to select the right lens. As I told about the types of lenses, one can choose monofocal, multifocal, or trifocal lenses. According to the need, one has to decide whether they can use glasses for reading or they want spectacle free light. Second, material of the lens. One should choose hydrophobic material, then hydrophilic. Uh, Third, sometimes doctor will suggest that this patient has cylinder power more than 1 or 1.5. So for spectacle-free distant vision or spectacle-free near vision, we need to implant a toric IOL. So that doctor will advise, and then you can go ahead with the toric monofocal or toric multifocal. Coming to the next question. My wife got cataract when we checked for her glass. She is 55 years. She got wheezing problem. Okay, I'm using 4 100. She is also diabetes. Question. I'm not getting what is the question, but okay. Uh, she is 55 year age and she has a cataract. I can tell you one criteria when to operate. There is no such fixed criteria that yes, we have to operate if there is a region is 66 or 69 or 618 or 636. No, one should operate if there is a uh, have impairment in the quality of life. For example, if patient has a good vision, patient has a cataract, patient has a good vision, patient has a vision till the last line. We call it as a 6 by 6 vision. But still patient has a problem in night driving or driving, and that causes impairment in his quality of life, then that patient should surely can go ahead with the cataract surgery with implantation of the lens. Okay. Now in this question, he asked about she got wheezing problem and she is on steroid. Okay. And diabetes. Steroid, she is taking steroid, no problem. She can go ahead with the cataract surgery, but diabetes is the problem. Check for the cataract surgery. Okay. Next question. Uh, can a person who has undergone cataract surgery of both eyes donate his or her eyes? Yes, sure. The person who has operated for the cataract surgery can go ahead with the eye donation. I will explain you why. Usually, we do cataract surgery here at the natural or cataractous lenses. And in eye donation, we remove only the cornea. Cornea of the means anterior corneal part of the eye can be useful of a dead person to the alive person. So any cataractus patient can go ahead with the uh, eye donation. There are some different criteria. Um, Next question is cylinder power means, are you referring to astigmatism? Yes. Cylinder power means astigmatism. Usually, as I told, the cornea is the spherical surface, but sometimes there are different curvature. Sometimes uh, uh, the power of the cornea is not spherical. Uh, the power comes only on the one axis. We call it as a cylinder power, and we call it as a astigmatism. Any other question? Yes, I got one more question. Usually, no doctor use contact lens. They prefer external spectacle. Is contact lens or implanting a lens less recommended from external spectacle? No, it's not. It's not like someone cannot use contact lens or intraocular lenses. Intraocular lens we usually implant only after cataract surgery. But sometimes it is recommended to use ICL. We call it as a ICL lenses in high power. But yes, one can use contact lenses. It is there is no any other contraindication for the contact lenses. Doctors don't use contact lenses because I think they don't have time to wear the contact lenses in the morning and remove at the night. So that may be the probable cause. Otherwise, one can surely go ahead with the contact lenses. And implanting lenses inside the eye is only after the cataract surgery. When do we suspect that a cataract is being developed? Is there any non-surgical remedy? No, there is no non-surgical remedy. If someone feels that there is a blurring of a vision, then you can go ahead to your any nearby ophthalmologist and get checked for your eye. Then you can able to know about the cataract. Vision, how much is your vision? That is the only symptom of cataract. What precautions to be taken post cataract surgery? Yes, this is very important question. Um, as I said, nowadays due to development of phacoemulsification, cataract surgery becomes a daycare procedure. There is no need of admission inside the hospital. One can go to home within half an hour to an hour after surgery as soon as patient feels comfortable. Uh, one should not precautions. One should not touch their eyes. One should not wash their eyes at least for 1 week after the cataract surgery. First week is very important for the healing and to prevent the infection. Uh, Second, as doctor prescribed drops after cataract surgery, one should use that drops in the correct dose. Okay, whatever doctor suggests, that should be done by correct dose. Rest of the things, rest daily activity patient can do as advised by the doctor. Mm. Only thing, drops, we should use drops correctly. Second, we should not touch their eyes and we should not wash their eyes for at least 1 week. Routine work, they can start after a few days. Uh, yes. So the conclusion or take home message from today's presentation is one should check their eyes if there is a blurring of vision, uh, if there is a cataract and a cataract surgery advised by the doctor, they should go ahead with the cataract surgery. When should we operate if they suggest a cataract surgery? Cataract surgery is not an emergency procedure, but yes, if there is an impairment in a daily activity, then patient should go ahead with the cataract surgery. Second thing, now a cataract surgery, we called it as a cataract surgery as a refractive surgery, in that surgeon tries to minimize the post-operative spectacle power. Uh, one should choose a intraocular lens depending on their need and their lifestyle. Okay. Any other question? Okay, I think question answers are over. One more question is there. How to maintain healthy eyes to delay cataract formation? Uh, as cataract is an aging process, so we cannot delay in the cataract formation. But yes, definitely some vitamins we can increase in our diet, like vitamin A, vitamin C. These are important for our normal eye health, uh, and omega 3 fatty acid uh, that is present in akhroad and all, some dry fruits. Uh, but we cannot delay cataract formation um, as such by any drug or any other means. It is a natural aging process. But yes, if the cataract develops due to long-term use of steroid, then we can reduce the dose of the steroid. But yes, life is more important than these things. We have more sophisticated treatments there. So that also steroid dose, whoever is using steroids, that should be under the observation of their doctor only, and should not stop any medication before or after surgery without suggestion of doctor. Any other question? So okay, so I think there is no questions. Thank you, everybody.